Good afternoon, everybody. It's 4 o'clock. That time we come together to remember that we're going to get through this, and we're going to get through this together. Elections were last night, and I know some of the results are continuing to come in, but the virus is still here. So let's remember that it takes all of us, regardless of who we voted for or who we support in a political election. Coming together and doing the right thing is about saving each other's lives, which I hope is more important to each and every one of us than just about anything. I want to thank W.E.B. Du Bois Academy in Jefferson County for sending me this mask. They are doing innovative, incredible things. I'm very proud of that institution. Thank you for keeping your folks safe. We're going to start today and in the coming days a little bit different. And we normally talk about a fast 4 at 4, which is just a way to provide some additional news on what's going on in state government. But I thought, given how difficult the COVID reports have been, we're going to start instead each day by trying to provide some good news, good things that are going on out there, because we all need a little bit of good news right now. And there are some really good things going on throughout the state, around state government, that tells me that we have a lot of promise moving forward in Kentucky, maybe more potential coming out of COVID than we ever thought was possible as this world changes. And so I just want to try, as we go through what are probably going to be a difficult couple months, to give you some good news. The first is good news to a lot of folks that work in state government, but also to so many that get services from us. Today, based on the recently released quarterly economic and review report issued by the Office of the State Budget Director, I'm able to tell you we're anticipating that we are going to be able to balance our current fiscal year 2021 budget with no further budget cuts to state agencies or to the state's road fund. Not only that, we anticipate finishing this fiscal year with more than $460 million in what's called the Rainy Day Fund, and that'll be the largest amount in the state's history. And this is really good news because it means areas like education, healthcare, and public safety will not face cuts that we thought that they would in a time where the services that they provide are so essential. Now, a number of factors have come together to avoid what we thought could have been a very difficult fiscal year this year. And right now we're anticipating a very difficult one in the next year. But it's a couple different things. We've had better revenues than anticipated. And we believe in large part that's because of dollars that are flowing through our economy through some of the different COVID relief efforts from the state and from the federal government. Certainly unemployment with the additional $600 and $400 programs, we have seen flow through better than we anticipated. It is being spent. That is helping businesses that are out there, and it's also coming into the state in a very positive way. We've also invested substantial dollars in our COVID response in Kentucky business and Kentucky communities. That's everything from the $300 million in reimbursements to local governments. Those dollars flow through the communities, to spending our dollars on testing with state-owned and labs here in Kentucky, ensuring that significant dollars that we're spending stay right here. We've also tried to use our partners in Kentucky, significant investment in healthcare, whether it's our nurse strike teams for nursing homes and other areas in the need. Our goal has been to spend all of these dollars in ways that benefit Kentuckians right now, while also keeping us safe from COVID. I also think that we've been able to make sure that we continue spending in our transportation cabinet to improve infrastructure, which again creates good jobs, which creates revenue for the state. The final piece, though, is additional flexibility in CARES Act money that was announced on Labor Day. That's going to help us to fill the hole that otherwise would have been there, but to provide uninterrupted services in so many important areas. That means we don't have to ask higher education, for instance, for what we thought could be up to an 8% budget cut. The same for so many other important areas of state government. Now, this all anticipates that the revenue outlook that we have going through June 30th of this next year stays true to what we're seeing. But I think that this is good news. What it means is the first two budget years that I've been entrusted with, we've not only met our budget, but in fact have had more money and kept more money in the rainy day fund than ever before. And that's something that we are certainly proud of, but it's also our responsibility. We got to balance budgets. We got to pay the bills. That's expected of every family. That ought to be expected of state government. All right, this next piece of good news mixes jobs, which we all want more of, and good jobs, with a new company in Kentucky that will be creating PPE. In other words, we will have jobs, and it'll help our supply chain, both during this pandemic, but in future ones. Having these labs like Blue Water Diagnostics, and like our Northern Kentucky partner that has Gravity has helped us so much. That's one of the reasons that we've had such good testing in Kentucky. This can help us certainly to be more secure in our PPE. So we have been able to keep Kentucky moving forward through this pandemic with announcements of new jobs and some of our Kentucky companies expanding. But today we have this particularly exciting announcement. U.S. Medical Glove Company is a new company. It is planning to create good paying jobs, planning to hire veterans, and will manufacture much needed PPE right here in the Commonwealth. The company is locating in and expanding an existing Bourbon County facility with a nearly $32.5 million investment. It's going to create 192 full-time jobs in Paris. U.S. Medical Gloves plans to source latex-based nitrile from Louisville-based Xeon Chemicals for the production of its gloves. The company expects to begin production in the first half of 2021 with 45 high-level computer technicians and to add staff as new lines are installed. This company is led by the leadership of the CEO and retired Major General Michael Davidson, and the company plans to center hiring efforts around veterans in that area. We are proud that around 100 manufacturing facilities in Kentucky have used existing operations to provide PPE to companies and organizations in need through this year, and this just adds to it. From masks to ventilator components to hand sanitizers, our Kentucky companies have stepped up and have answered the call and have protected the citizens around them. Oftentimes, they've done it even knowing it's not going to help, or maybe it even hurt the bottom line, but we have seen that type of citizenship and corporate citizenship during these difficult times, and it's something we can all be really proud of. Securing PPE has been a success for the Commonwealth. We now have a 120-day surge supply. We have been able to warehouse it. We even purchased the materials ourselves for our field hospital to be able to set it up and tear it down in very quick fashion, but also to be able to reuse it in the future. Very excited about this announcement, U.S. Medical Glove, for not only locating here in the Commonwealth, not only being a new company getting off the ground in Kentucky, not only with plans to hire so many Kentuckians in the Paris area and Kentucky veterans, but also to be more secure in our ability to get PPE moving into the future. All right, third piece of well, it's good news. Mainly, it should be reassuring news. We have now received the White House's newest report for this week, and its recommendations, more than ever, tell us that we are on the right track and that this White House supports the steps we're taking here in the Commonwealth. That means that we have bipartisan agreement, state and federal as well, with all the health experts pointing to the same things, saying that if we can come together, especially with our red zone recommendations and everything that goes into it, that the White House believes that it is our best chance to succeed. So first, the White House has now specifically endorsed our capacity restrictions. They list specifically restaurants, and their advice is do not increase those as it gets colder until we can get the virus under better control. Now, this is one of the first times that we have seen just a direct endorsement, though we have had many positive comments about the need or the continuance of what we already have in place. Second piece that they're talking about is our curfew, about when they close. Again, White House supported. Third is something that we did early. It was the right move. It has ensured that we don't have spread or as much spread as we could have in our schools. And our schools are doing a great job of this, but the White House now talking about masks being worn at all times by students and teachers in K through 12 schools. So again, bipartisan agreement that this is the right thing. And we're seeing it borne out by really hardworking teachers and administrators that are really doing their best. All right, next part of their recommendations, again, track the advice that we've been giving you on a day-to-day basis. Don't gather without a mask with individuals living outside your household. That is inside or outside. If they're not in your immediate family, you need to have your mask on. Always wear a mask in public places. And finally, this is one that we're talking about in our red zone recommendations, and it's a tougher ones, but stop gatherings beyond immediate household. That's canceling public and private events. That's not even having the 10 people over to your house until cases and test positivity decrease significantly. Third set, because again, these were a number of recommendations they made. Color coding and community action plans are good practices. Folks, that's exactly what we're doing this week, being our first week with the red zone recommendations for government, for business, for the broader community, for schools, for long-term care facilities. And what they ask is that you and your community fully buy into them and that we promote them and make them visible. And I'm seeing that. I'm seeing a lot of communities not trying to shy away from being in the red zone and not letting it be explained away by this or that in the community, but truly accepting that it's there, that it's a challenge, and that they are ready to continue to provide leadership to address it. And we don't have a choice because it's that bad. And if we want to keep it from getting worse, we need that type of leadership. Also wanted to finally talk about the mask mandate. We are going to be re-upping it for another 30 days. We have seen, when I showed you Tennessee versus Kentucky, what happens and where we would be without a mask mandate in terms of additional cases and additional deaths. But this is also a mandate that is supported overwhelmingly by Kentuckians. So the New York Times did a survey of the electorate that voted yesterday, and they asked them a number of questions. This is the electorate that voted the way they did last night. 71% of that electorate strongly or somewhat strongly favor requiring people to wear masks when around other people outside of their home. Kentuckians strongly support this mask mandate. They know how important it is. They know their health is on the line and the health around them. So look at that number in Kentucky. This isn't a political thing. It's people doing the right thing, and then some people we need to bring along and talk about the importance of loving your neighbor as yourself. So regardless of any changes that we see in the makeup of our government, this is the will of the people, and it's the right thing to do. And they get it. This is an infectious virus that can spread through droplets and others. Why wouldn't you wear a mask to stop those from getting to other people? And just a couple of folks that are out there doing it right, wearing their mask. First, we've got Stephanie Turner, who again is showing us how you can do
multiple civic duties. This was voting and masked up. But then the second one is great. This one is from a different Brittany. This is a 3-year-old who loves his cool mask and makes him question others. So I think that's a pretty cool mask too. All right. Now we will do the COVID report itself. Then we'll have Dr. Stack talk about impressions and concerns on hospitalization and hospital staffing. And then we'll have Secretary Friedlander give us an update and kind of an in-depth recap of what we've been doing with long-term care facilities and what we're doing into the future. I mean, it's going to be, by the time this is over, more than several $100 million that is being used to do everything we can to protect your loved ones in one of those facilities. So we continue to see high cases. Today we have 1,635 cases. Now this is a little bit below last week's. It's still, I believe, in the top 10 highest cases we've seen. One thing we don't know is if it's impacted by Election Day yesterday, because we've always seen the day after a holiday potentially be a little bit lower, but we don't know that yet. But 1,635 cases is way, way too many. It brings our overall number of cases to 113,009. 113,009. Our numbers hospitalized go up every day. We're now at 1,066 in the hospital with COVID. On the ICU, 286 Kentuckians today. It was 259 yesterday. These are a lot of Kentuckians that are fighting for their lives. 125 Kentuckians on a ventilator with COVID, just 116 yesterday. Test positivity continues to be far too high, 6.30% today. New cases by county: Jefferson 352, Fayette 159, Kenton and Warren 64, Laurel, McCracken 56, Boone 46, Campbell, Davis, and Hardin 38, Christian 34, Floyd 31, Bullitt 28, Henderson 25, Caldwell 24, 22 in Barron and Montgomery, 17 in Graves, Grayson, Greenup, and Shelby, 16 in Lincoln, Nelson, 15 in Franklin, 14 in Madison, Monroe, and Pike, 13 in Scott, 12 in Hart, Marshall, Oldham, Simpson, and Spencer, 10 in Breckenridge, Pulaski, and Woodford. A number of other counties in the single digits. Again, those are online at kycovid19.ky.gov. Today we've lost 11 additional Kentuckians, putting our total count now at 1,514 of our brothers, sisters, parents, grandparents that we have lost due in part to the coronavirus. Today they include a 72-year-old man from Jefferson County, a 59-year-old man from Jefferson County, a 72-year-old man from Jefferson, a 60-year-old woman from Jefferson, an 89-year-old woman from Jefferson, a 79-year-old woman from Hancock, an 82-year-old woman from Knott, a 71-year-old man from Jefferson, a 91-year-old woman from McLean, a 96-year-old woman from Hancock, and an 81-year-old woman from Jefferson. Let's keep lighting those homes up green. Let's keep ringing our bells at 10 a.m. A lot of pain out there, and it's hitting everybody. I learned about a couple that Brittany and I are close friends with that are dealing with a parent that's in really bad shape because of COVID, and we're thinking about them, and we're thinking about every family, whether we know you or don't. We hurt with you, we grieve with you, and we are sorry that this is happening out there. It's creating not just difficulty and inconvenience, it's causing death. And we will all pledge to do better every day to make sure there are fewer families like yours going through something like this. Long-term care facilities, which the Secretary will talk about. Today's update: 116 additional residents testing positive, 75 new staff, 16 additional deaths attributable to patients in those facilities. All right, with that, I'm going to ask Secretary, I'm going to ask Dr. Steven Stack to give us his thoughts on where we are and what we are seeing. Steve?
Thank you, Governor Beshear. Good afternoon, everyone. I'm going to talk about where we are with hospitals right now and also with red counties. And so at the end of September, on September 28th, we had about 507 people in the hospital with COVID-19 in Kentucky. Fast forward to about 1 month later, on November 2nd, we had 988 people. We had a day at our peak where we went over 1,000. In the ICU at the end of September, we had about 106 people, and we now have, just 2 days ago, 270 people on the graph that I looked at. So we have approximately doubled the number of people in the hospital with COVID-19 in regular medical or surgical beds, and we have substantially more than doubled the number of people in the intensive care unit. Those are significant leaps, and the problem is the same for the hospital care that happens with the disease overall. The more people who are getting sick, the more quickly those numbers can climb. And so this is a concern. Please remember, too, we don't know for certain, but we think the mortality rate or the death rate associated with this disease is probably around 1%. And so for every 1,000 people who become infected, there could be as many as 10 people who die from it. Additionally, we think about 10% of people who get COVID-19 have prolonged recoveries. By this, I mean it's not like strep throat or the common cold, where you get sick and you feel poorly for a week or 10 days and then you get better. It is common for people to have illnesses where they feel fatigue, brain fog, loss of energy, lingering shortness of breath, sometimes for 3 or 4 weeks, which certainly can impair people getting back to work in a timely fashion. Now, one of the concerns we have related to hospitals is not that we will first run out of bed space, but that we may not have enough healthcare workers to staff all those beds. So I want to share this by way of informing the public. I also want to share it to solicit and enlist the participation and additional help for our colleagues in healthcare. Folks typically don't get infected in the hospital. And so I should emphasize this. If you need care, go to the hospital if you need it, and seek medical care from your doctors or primary care providers. They are prepared for you now. They have the equipment they need to keep themselves and you safe, and they are ready for you. So please do not stay away from or seek to get or refuse to get care because you are concerned about COVID-19. If you need care, please go get it. The healthcare community is ready for you. This being said, healthcare workers, when they go home in their private life, that is where they are getting exposed to the virus. And healthcare workers who get exposed to the virus in social gatherings away from work have to quarantine just like everybody else. So the problem we have is when the disease is very common, more citizens in general get exposed, more people get infected. When healthcare workers are out in the community interacting with everybody, they get exposed and also get infected, and then they can't come to work. And all of us need all of them to be available to help us should we get sick and need medical care in an office, a clinic, or a hospital. So I have to urge the public that this is really important because there are cascading problems where this gets worse. If we keep spreading infection more easily, more of the people we rely on to keep us safe and to treat us when we're sick will themselves be sick and unavailable. And then we won't have access to their healing arts and skills when we need it most. For those who are healthcare workers, thank you for your service. All of us are deeply indebted to you. I'm very grateful to you. But please don't let your guard down when you're away from the hospital or the office. Please continue to be every bit as disciplined in your private lives as in your work lives. It's not easy, and we've asked so much of you and we're very grateful for your sacrifices. But this is so important because otherwise we're going to run the risk of not having enough of you to provide care, and obviously it makes the burden worse. I know this from personal experience in the hospital. When there's not enough people to get the work done, it makes it harder on all the people who are remaining. And this will lead to my comments on red counties. We have an alarmingly large number of red counties. Red counties are those places where we have more than 25 new cases per 100,000 people. To put this in context, if you look on our website today, you'll find a number of counties who have 40, 50, 60, and even at the highest number I saw, 91 or more new cases per 100,000. That means at 91, they are more than 3 times, in fact, almost 4 times the level that it requires to be in a red county. In red county determination, that level, that cutoff, is decided by entities like the World Health Organization and the CDC, who find that at that level of disease transmission, the disease is spreading rapidly and is a very real threat. And so the only way we get this under control is for people to please wear your masks, keep your 6 feet distance from each other, wash your hands or sanitize them. Please also stay home if you are sick. If you have fever, cough, shortness of breath, or other symptoms, please do not go to school or to work. And then, of course, if you think you have infection or were exposed to COVID, please get tested as appropriate. I will admit it does feel at times like begging us to do these things. I know that's in part because it's so difficult. It has disrupted our lives so much. I just have to tell you, from everything that I can see around the world and what happens here in the United States and other states, if we don't follow these guidelines, if we don't do these things, the disease will persuade us to follow them at some point. And it is a much more unpleasant way to comply when the disease takes people from your friends or family circle or causes them harm or medical illness and disability. Please, let's not learn it the hard way. We've done so well and made so many sacrifices, and we are now within probably a month or a little over a month from hopefully having some of the first vaccines available. And so hopefully when we enter 2021, we will be able to start to see a little bit of light at the end of the tunnel. Let's all please pull together to make those sacrifices that were so painfully given well worth it to keep everyone as safe as we possibly can and get through to a better time next year. So thank you very much, Governor Beshear, and I think Secretary Friedlander is going to come up now and talk to you about the long-term care facilities.
Good afternoon. I'm here today to talk to you a little more in depth than I have usually about long-term care facilities. As I've said before, long-term care facilities, congregate care facilities, those are places that around the world and across the country have been those places that have been most affected by COVID, most vulnerable to COVID. And we have tried to take aggressive steps in the Commonwealth to assure individual safety. But as you heard, we've seen an increase in long-term care. And what that has to do with is community spread. And I'll get back to that in the end. So as I've talked to you all before, we took early and aggressive steps. March 6th was when the very first case came to Kentucky. And very soon after, we issued an executive order with respect to visitation, really earlier than most states in the country. And it's that aggressive action that we think limited some of the early exposure. We relied on all sorts of other guidelines, CMS, the CDC, our own public health, as we tried to counsel and guide and establish and operationalize all these new guidelines that were coming out across the country. And as always, our partners at Norton Healthcare really stepped up early. They provided very early. They had what is their poison control call line. They provided very early additional support to us and a 24/7 call center for long-term care facilities to access and connecting them with the public health resources. Trayton Oak Towers, remember, a long time ago, they took advantage of that kind of support. That partnership allowed us to install 10 regional infection control specialists across the Commonwealth who were able to give and are able to give advice to all facilities across Kentucky. They also partnered with us when we were beginning to deploy that statewide testing for all our nursing facilities. They actually went into facilities and helped them with their testing protocols. An example of that is they helped the VA and Thompson Hood to go through some of the testing protocols and support them as they went through and learned what those protocols could be and how to implement it in their facility. We also, again, formed this cross-functional team, this long-term care task force of nationally recognized leaders that reside here in Kentucky, our universities, medical directors from facilities who helped us establish and are helping us work through guidelines that are rational for Kentucky, that are implementable, and that will support our long-term care facilities, our staff, our residents, as we navigate through what has been an unprecedented time. I know that word gets used far too often, but gerontologists, medical ethicists, keeping us focused on what is important, and that is the safety of our seniors in these facilities. In Medicaid, we changed how we get people eligible for Medicaid in facilities. We provided this presumptive eligibility to nursing facilities. Oftentimes, to get eligible in a nursing facility, it took months. We were able to cut that down and provide nursing facilities, families, residents, a much faster path to Medicaid reimbursement. And as a matter of fact, we think we see an increase year over year for reimbursement to nursing facilities. There aren't a lot of facilities that can say that. We also deployed a plan around testing supplies, around PPE and inventory needs as they arise. Nursing facilities could apply and try to get and get additional PPE through our web EOC resources, through our resources, and what was done to provide additional PPE across the Commonwealth for our facilities. And Dr. Stack and his team did a tremendous job of getting more supplies available. For example, 807,000 masks, 279,000 face shields, 200,000 gowns, and 550,000 gloves. And these facilities can continue to request support through the web EOC. At a certain point, we had state parks designated as an area that long-term facility staff could self-isolate following a positive diagnosis. We leveraged CARES Act funding to assist facilities in the purchase of PPE, electronic devices for connecting residents and patients, and also through Medicaid, expanded telehealth so that instead of having to take people out and move folks around, there were opportunities to provide healthcare virtually. And that was a tremendous expansion. We also then used what is called our civil monetary penalty funds in the Office of the Inspector General to support facilities in a couple of ways. First, again, for that communication for families and residents and providing iPads and those kinds of things that would help facilitate communication, because the isolation through all this has been very hard on everyone. We also supported some outdoor places and some very minor construction on outdoor places where families and residents could socially distance and with a mask have some interaction. We provided many links for behavioral and emotional health resources with special emphasis near Mother's Day and Father's Day and Grandparents' Day. We work very closely with Leading Age and the other long-term care associations as we are on the phone with them at least weekly and often many times in a week to coordinate with them, and they have been good partners with us. We adopted a very aggressive testing approach. Twice a week in red counties per CDC guidelines. And it follows the same map that the governor just referenced as we look at red counties. So we provided very, very close to 350,000 tests to long-term care. And we think before the end of the year, we'll reach close to 800,000 tests that we will provide through CARES resources, supported by the state. We think we've already spent over 30 million in tests that have been provided with CARES funding. Now, at the end of the year, that CARES funding ends. We need more federal support to continue some of these vital programs. We also purposefully, and we think very thoughtfully, began to reopen, right? We began to reopen transportation. We began to reopen some of that congregate dining. We began to loosen some visitation policies. But I will admit, we were very careful and very incremental. And that was intentional because, again, we are trying to keep residents safe. We completed many COVID-19 required inspections at facilities. We resumed our annual facilities inspections and conducted around 800 focused infection control surveys through our Office of the Inspector General. Staffing. Lots of challenges around staffing, positive staff, finding qualified staff, finding enough staff that nursing facilities face. And we absolutely acknowledge that has been an issue across the country. Some of the things we've done to support that, we've been working on and developing what is called a personal care assistance program. It's sort of a new category of individuals who can work in very limited roles in long-term care facilities. We know we provided over 250 of those individuals so far for long-term care, and that is made sure that we allow that under our regulations, both our licensure regulations and our reimbursement regulations. We've been working with great partners, the Kentucky Community and Technical College System, to increase certified nursing assistant testing. That has been a bottleneck for CNAs to become certified to begin to go in facilities. And KCTCS helped us with that. And they're continuing to work with us to work on, beginning next year, hopefully very early next year, a virtual way for CNAs to get and go through coursework and test. This will be a tremendous improvement and hopefully a pipeline for more staff to long-term care facilities. And coming to a close, we talk about Dr. Stack and Dr. Stack's team, and this group, the Inspector General, Adam Mather, Keith Knapp, who works out of my office. These are the folks that have really put together these plans, brought the long-term care task force together, have been on numerous calls, and really working hand in glove with the providers and with the associations, but also a special shout out to this group. The hospital-acquired infection team working at DPH. These folks have done yeoman's work, heroic work in working with facilities all across the Commonwealth. We know that they have been in contact with over 354 congregate facilities across the Commonwealth. That's personal care. That is all the nursing facilities. The folks that work in assisted living. They have supported a tremendous number of folks across the Commonwealth and have helped them through very difficult times in partnering with our local health departments and our hospitals and local EMS. They have pulled these groups together to make sure that we have an effective, impactful local response. And I can't say enough about them. So We will have new holiday guidelines coming out. Thanksgiving's coming up. We know this is a very difficult time for families and residents. We do understand the isolation. I have personal experience with that. So please know that we understand. But the thing that we focus on is making sure that residents of long-term care facilities, our seniors, our parents and grandparents and great-grandparents can be as safe as possible. So we're seeing this increased community spread across the Commonwealth. That is the driving factor in a lot of these long-term care facilities. You know, we were doing really good for a long time in keeping this community spread down, in keeping red counties as few as possible. But now we're seeing that increase. The governor addressed, we're seeing an alarming increase in long-term care facilities because we're seeing an alarming increase in community spread. It's real. I've often reported to you that we've been below the median for the country in terms of case rate, in terms of deaths in facilities. We are just now passing that median. And that is because of community spread. And you know what we can do to stop that? We can wear one of these. We can wash our hands. We can observe the guidelines that the governor talked about around red counties. It makes a difference. We can protect our seniors. All we have to do is this. Governor, I turn it back to you.
Well, thank you, Secretary Friedlander. I asked Eric to go through that today, and I asked him to do it in depth, so that was my fault. But I asked him to do it because while we have talked about bits and pieces of the work that the state and others have put in to protect our most vulnerable in this virus, I wanted you to be able to hear about the totality of it, how many people are working so hard. And I think to give you an example that more work is done to stop the virus getting in these facilities than anywhere else. Yet right now it's still getting in. And that's because we, the community, need to do a better job of doing our part. Lessening cases means less virus gets into these facilities. And let me thank everybody who works in those facilities. I know you're tired. I know you probably go to work scared often, but you are so special, and we appreciate the fact that you keep showing up to care for those that need you. All right, we will open it up for questions. Have some on the line and some that are written. I think we're starting once again today with Tom Latek from Kentucky Today.
Thank you very much, Governor, and good afternoon to you. I have a question. Early on during the pandemic, you and Governor Holcomb in Indiana, Governor DeWine in Ohio, and a couple of us kind of formed a consortium where you guys kind of planned together, worked together, and all that. Are you still doing that, or is everyone back to being on their own pretty much now?
We have regular calls with that Midwestern Consortium group. I think we had the last one just a couple weeks ago. In addition, I do, I think, a call every 2 weeks just directly with Governor DeWine and Governor Holcomb. That has been a really positive working relationship. And even though we're of different parties, all of us know that this virus is real and have worked well together. We share different strategies we have. Nobody holds anything back. And we've been able to use a lot of what's been effective in other states to help our own citizens. All right, next up is Debbie Yetter from the Courier-Journal.
Hi, Governor. Senator McConnell today, apparently in a radio interview, indicated that he believes it's time to put aside, his words, partisan passions and get Congress back together working on a relief package for states this year before the end of the year. Wonder if you were aware of that and your thoughts on that.
I heard that, and it's good to hear. I haven't had a chance to congratulate Senator McConnell yet. We're setting up that call, but congratulations to him on his reelection. We desperately need it. We need it in a number of ways. I oftentimes talk about help on local and state budgets for the next fiscal year, but the most immediate need, and I know there's a lot of them out there, are for our small businesses that are suffering, and the PPP loans is some amount of additional unemployment. And while people argue about the amount of it, it's necessary to survive, and it cycles through our economy well to support businesses out there. The third piece is we've got to have additional money next year for testing, for PPE. We're still going to be dealing with COVID through at least part of next year. We're going to want to make sure we have that testing out there, and we may well need support for how we distribute the vaccine. But I was glad to hear on this first day after the election that he's wants to get that package passed. I look forward to talking to him about it. Melissa Patrick with Kentucky Health News. We'll give one more minute to see if we've got Melissa. All right, we'll come back. Catherine Collins. Oh, there you are.
Oh, I'm sorry.
Ahead,
I needed to hit the. How are you? I'm curious. The 7-day rolling average sets new records almost every day right now, and you talked today about the hospitalizations and the ICU numbers skyrocketing. Have you ruled out taking any further measures beyond the ones already in place to slow the spread?
We haven't ruled anything out, but we have not received any public health advice either from our federal experts or our state experts that at this point has suggested any new additional measures beyond the red zone recommendations. We put together those recommendations to help each community, and if you'll put them up, James, each community come together with every single part to have every single person in that community working to tamp down cases. And about 2 weeks after we announced that, the White House is now pushing that concept out. And it wasn't just ours. West Virginia was doing something like it, and many others. We took it and worked to make it work best in Kentucky. But this right now is their push. Now, some things that I would like to see that I think would work is I think we need a mask mandate nationwide. And we share borders with other states. Two of them have a mask. Most of them have a mask mandate. Two of them don't. One that doesn't, that border is a real problem. So once we figure out the rest of this election, I hope that whoever is in charge as we move forward, I hope that is something we can certainly see. But let me also say, if we don't get a hold of the virus, then we're going to have to look for other options, and none of us want to do that. But we can't let this just run throughout our entire population. The amount of death we would see out there from basically just giving up would be not just unacceptable. It'd be truly, truly awful. And that is all avoidable death. And I'd hate to look back at this period in our history in America and say, and the number's over 1 million, I believe, that we let over 1 million people die that we could have saved. Catherine Collins from WLEX.
Hi, Governor. Can you share your thoughts on how the election went yesterday and how likely you believe it is that the legislature will make permanent some of those expanded voting options?
Well, I think that the election set nearly a turnout record. I think it was the most votes that we have ever seen cast. I think we were able to do it in a safe way. People had all different types of options to do it. I don't believe that having that number of options favored any one party over the other. It was just good for all Kentuckians. And this is what happens when there's a little bit of bipartisanship. I've been able to work on a bipartisan basis with the White House, with other governors, with our local leaders, with Secretary Adams, and this was a good agreement that the Board of Elections also worked very hard with. Now, given that everybody loved the convenience, let's make it all permanent, all of it. Let's give people the options to do a no excuse or a limited excuse absentee ballot. Let's have voting early. And I think that we ought to consider having the full amount of early time that we had for voting. Part of government is service. We serve the people of the Commonwealth. They are our tax-paying citizens, and they liked how this election was conducted. So I believe that I think it's likely at least some pieces go into law, but it should all go into law. I think that this election and the way that it was handled was a huge success, and it was done safely in a time of a pandemic. Stu Johnson from WEKU.
Hi, Governor. You began the briefing today talking about revenues coming in better than anticipated. You mentioned that there may not be the need to ask, for instance, for 8% from the higher education community. So when you gave your budget address in January, would you anticipate then a status quo budget?
Yeah, so the budget that we're talking about, and Stu, I know you know this, that we will not have to have budget cuts if things continue, is the one we're in right now that ends on June the 30th, with a lot of the uncertainty that was out there with original stricter limitations on how we spent CARES Act money, with no one anticipating that the dollars would flow through the economy as well as they have. We believe that up to 8% budget cuts were going to be required, basically, that would be borne over the next, 8 months that are left in this fiscal year. Now that we believe that those won't be necessary, we wanted to make sure our agencies and all the people of the Commonwealth know about it. But we are seeing GDP shrink. We are seeing concerning signs for the economy next year, the next fiscal year. And right now, that raises concerns about what the next budget without federal assistance will look like. It would most likely have to be leaner, if not significantly leaner, than the current budget we're in, which is already pretty lean. So our next budget address will depend a whole lot on the next CARES Act that goes out. And if there is not additional support for state and local governments, it is most likely to be a tough budget, and unless we see some changes in what we're forecasting for our economy. Now, that's possible. I don't think it's probable, but it's possible, given that the economy could bounce back faster than anticipated, depending on how quickly the vaccine gets out, or frankly, our economy will bounce back a lot faster if we follow these recommendations. We do what's right and we tamp down the virus. If we can get the virus back under control, the economy will come back a heck of a lot faster. John Boyle from WFPL.
Hello. Just had another question about last night's election results. With Republicans picking up some more seats in the legislature, we're curious to know if that's going to change how you approach managing the pandemic, and also just wanted to hear your thoughts on how it's going to affect your approach just dealing with the legislature, pandemic or no pandemic.
Well, I hope that our new legislators and our folks that are continuing to serve come to Frankfurt in January, ready to better the Commonwealth and put politics and the rest aside, especially as it relates to a pandemic. I don't believe that the way people ultimately view what we should be doing in this pandemic comes down to politics. And frankly, what we ought to be doing it comes from public health, obviously, with weighing other concerns and harms that are out there. Earlier, we showed the voters that elected these new representatives and kept others. 71% of them of this electorate supports the mask mandate, for instance. So my hope is that the legislature certainly wants to follow the will of the people. But I'll say this: not every relationship when your governor is always smooth. But I've shown that I'm willing to work with anybody who's willing to work with us, without the slings and arrows or the rest. And I'm committed to doing what it takes to defeat this pandemic too, regardless of what that means about my future or reelection or the rest. And so I just hope everybody else shows up ready to do what's right. And if you have an even larger supermajority, why are we worried about politics? Let's just do the right thing. All right. How concerned am I about stripping of authority to fight the coronavirus when the legislature returns? It could be disastrous if it happened. I mean, everything from how we pulled off the election to the mask mandate to funding for public schools, making sure that we have workers' comp for our first responders that are first forced to quarantine. And you can't manage an emergency. And yeah, this is a long emergency, but it's still an emergency with 130 something people. It's tough. And that's one of the reasons that you have a chief executive. But they'll be here. We'll work with them. And my promise is I will stay above the politics, and I hope everybody else does too. Answered that one. Let's go back to Tom Latek at Kentucky Today.
All right, thank you, Governor. Any updates on the outbreak that we had at the Little Sandy in Elliott County and maybe some of the other jails and prisons around the state?
Tom, we'll get you an update. We'll do a whole one tomorrow. I believe that our situation is improving, but we'll get you each and all of those numbers. What we do know is that our approach works, though it takes some time to stabilize. And again, what you see in the Little Sandy, even with all the testing we're doing, even with everything to try to keep it out of jails and prisons, once you have that amount of community spread, it's hard to stop it. I got a question on bingo halls and concerns of bingo halls operating, particular with older patrons with health conditions. That's something that we'll want to take a very close look at, both from, if you're operating something that attracts seniors, my goodness, you better be following every single requirement of keeping them safe and keeping them healthy. But I understand these are constituent concerns about how dangerous that could be. Debbie Yetter.
I think yesterday I mentioned that the Louisville health officials had sounded the alarm about the exponential growth in cases in this community and the impact on the healthcare system. Do you have any further thoughts about what that might mean for the rest of the state or what's happening in other counties that are red?
We are seeing something similar to what Louisville was describing in other areas of the state. Obviously, it's a different scale, but when you look at healthcare, there are fewer resources in other places than just Jefferson County. And Jefferson County, of course, serves healthcare needs in many ways of a much larger community. We are seeing or have seen at different times concerns on rate of hospitalization in Ashland. King's Daughter CEO talked about it. We saw it in Bowling Green at an earlier period of time, and everybody is ticking up right now. I read an article about it happening in TJ Sampson in the Barron County newspaper. I think we are seeing across the board our hospital administrators seeing this uptick and being concerned about it. And sadly, it's math. If a certain percentage of individuals who get it need hospitalization, the more people who get it, the more who are going to be in the hospital needing those services. But like Dr. Stacks said, we're not just concerned about the number of beds. We think we would reach a potential crisis point in staffing before we ran out of space. And regardless, once you hit that capacity level, that's when we start seeing outcomes that you otherwise wouldn't see, more loss. And so we want to make sure that we lessen cases so that doesn't happen. And lessening cases is the only way to make sure that doesn't happen, because this is happening everywhere else. So we're not going to be able to call in other healthcare providers from other states, given that we're seeing this surge everywhere. Melissa, Patrick.
Hi again. So we're 3 days into the red zone recommendations. Are you keeping a tally, I guess, of how counties in these red zones, if they're following the recommendations, or is it just anecdotal? What are you hearing from these counties? Are they actually following them, or are they not?
Well, we believe across the Commonwealth, the vast majority of counties are following the red zone recommendations. And the vast majority of those counties, every single part is trying to find a way to do it. And I greatly appreciate those communities. In fact, some communities are even looking for other steps that they can take. The last couple days especially, we've seen folks in communities stepping it up. Now, we have a couple that aren't all following every piece of it. But again, we hope that we can both encourage and explain the program in a way that will get that support. But remember, if you're in a red county this week, it's not just we need your government doing the right thing, and we need your businesses letting people work from home and your school system. We need you doing the right thing too, every single individual. But at least what I've seen in the last several days has been really positive. And with some communities that in the past have disagreed with recommendations that we have made, embracing these because the problem has gotten that significant. Catherine Collins.
Governor, WLEX had to jump off, so next is Stu Johnson.
Oh, okay.
Yes, Governor, following up on Debbie's question about the hospitalization situation, with where it is and the fact that there could be the need at some point for the field hospitals, is there a certain number that kind of triggers that when you talk about hospitalizations? And then what about the staffing for those field hospitals?
So the staffing for the field hospital will be handled either contractually by us or by the Guard that helped us before, was out there, was ready, and did a great job. We can get that set up in 7 to 10 days. So we're watching the numbers carefully. We haven't set a specific number that says go ahead and set it up, because it's probably more of the trend than the absolute number. You know, how fast are things doubling or tripling, and where is that happening? Because where we'd set up the field hospital, which right now the plans would be in Louisville, the same area that we had it, but we have some more flexibility with that. Also have a question here from WKU, where Stu is from, about the election, the presidential election, about counting of ballots, lawsuits, or the like. Everybody's vote should be counted. I think it's that simple. We have a way in place in Kentucky right now where it happens. Democracy counts on people voting. Let's not try to quiet their vote. That's not me trying to get to any result. I just think it's the right thing. If we tell people they can vote by mail, then we ought to count their vote. John Boyle.
You started off towards the top of the briefing mentioning that the coronavirus, it doesn't take a break just because of the election. But last night we saw some photos of some watch parties with some large gatherings, people not wearing masks, that sort of thing. So wanted to just hear some specifically the types of gatherings that are and aren't allowed right now under your guidelines.
So if you are in a red zone county, a red county, we are recommending that you don't have gatherings at all. Private gatherings outside of red zone counties, we need 10 or less. And that's because we're seeing a lot of spread through family or social gatherings. And that 10 or less we have in place as a mandate. Obviously, it's tough to enforce, but we need people to follow that. When you look at different facilities, they have somewhat different rules because they have the ability to enforce masking, social distancing, and the rest. And we really need them to do that if we're going to continue to have higher capacities at those places. If they are in a red zone county, then they need to be doing everything they can to postpone those types of things. Now, if you are having a gathering anywhere, whether it is your house or one of these facilities, and they are large and nobody's wearing masks, we can't be doing that. It's going to spread the virus. And right now it's there. That's the other thing. It's dumb, right? The virus is out there at an unprecedented level, and you're bringing a whole bunch of people together. You're putting their health at risk, and you're putting your health at risk. And I hope everybody thinks about that too. I mean, don't bring this home to your family, to your kids, to your parents, to your loved ones. So, all right, everybody, this is the first week that we have had these red zone recommendations out. If you're in one of these counties, again, please work really, really hard. Lives, health, our kids' education, our economy, those are all on the line. And tomorrow, Thursday, we will have the official counties that will qualify as red zone counties for next week. For everybody's leadership out there, thank you. From our county and city leaders to our faith leaders to our educators to everybody out there that's really trying to do this right. Thank you. We've been at it a while, but we don't get to choose when to stop. The virus will choose that, or we will, through our collective actions, lessen it, and then the vaccine will take care of the rest. So we're going to make it. Let's just make sure we're proud of how we do it. Thank you very much. See you tomorrow at 4.